guys. Okay, so I am on my way to work and I just want to make a quick video to give you guys an update on how I'm doing this semester. So I took my first test last week and I got an 81, which I am not too proud about. I didn't study the right things. That's where that came from. Our teachers, they're new professors, they weren't really giving us any information on what to study and how they test, where they're getting their questions from, because they were really pressing hard on ATI, so we didn't know whether to focus on ATI questions and they would tell us do certain questions from our Davis's NCLEX question and answer book. So we did those, and we didn't know where they were going with the test. So we were just studying every and anything. They were also really harping really hard on medication, so a lot of us was really focusing on the medication aspect, and it turned out that we didn't even have a lot of medications on the test, so we could have directed our study time elsewhere. But I know next time what to study for, so I'm really concentrating on the PowerPoints. I am doing a lot of questions, and I realize that that is helping me a lot, because I study the rationales of the answers, the right and the wrong answers, and I am building on top of my learning. And I think that's what's going to help make me more successful. And maybe you can try that too. If you get a question wrong, just build up on your learning, layer it with that extra information, so that when you see those type of questions, those conditions, when you see them again in other questions, oh, I remember from this question that such and such is this, and you're studying smarter and not harder. There's something I wanted to tell you guys. Yes, okay, so this is like my 6th week. This is my 3rd week of clinicals, and let me give you some advice on clinicals when you're in the hospital and you're shadowing a nurse. What you want to do is be proactive in your experience. This is your experience. This is what you have to take to learn from, and this is what you have to take into your work career when you actually become a nurse. So you need to be proactive when it comes to your experience. Do not expect that person that you're shadowing and clinical to take you by the hand, hold you by the hand, and make you learn, because they're not. 7 times out of 10, whoever you're following, they don't want you following them anyway. They're just being nice. So you're going to be following them like a little puppy dog, just going through with them throughout the day, and you're probably learning what they're doing, but you're not really getting any hands-on experience. What you want to do is get hands-on experience. Where's the camera? Where am I looking? You want to get hands-on experience, because that will help you absorb the information and retain it and actually learn it. Do the Pyxis. Practice, let them put in their information, but you practice pulling the medication. You practice checking it actually against the MAR. You practice looking at the expiration date and all those rights of medication that you need to do, so that you know what to do when that time actually comes. And I don't know how your program is, but before we do anything for the first time on a real human being, we have to get checked off by our professor. So before we pass an oral med, we have to call them, hey, can you come? I'm getting ready to pass an oral med. So they can check you off on clinical. So get as many skills checked off as you can, and then practice them. Now, there's going to be some times when things are going to be slow and nothing else to do. Be smart. Go somewhere and study. Especially if you got most of your stuff checked off on. Go somewhere and study. Come back and be like, okay, around the next medication pass, if you have any questions about documentation, always ask questions. Know the right time to ask a question, but ask those questions. Practice, see how they're documenting, what terminology they're using, and all of that. You want to do that because it's going to help you in the long run. So you make the most of your clinical experience. If you see people going around hiding in the corner, spending 1 hour on the floor and then going somewhere, hiding in little places. Don't be like that. Don't be like those people, because especially if you're not working already in a hospital, you need that experience, because you don't want to be that person when it's time for you to actually do your job and talk to the patient, and you know, talking to them like a little mouse, you know, without any confidence. You want to be as confident as you can, and you're going to get that with practice. And that practice is going to come from the experience that you're going to get at clinicals. And another thing I want to tell you guys about is medications. Medications, they're very hard to learn, especially the hard to pronounce ones. So what I do is, and I know you heard this probably from other people too, you make a story out of your medication. I'm telling you, it works. Okay, so let's talk about an oncology medication. This is like a breast cancer medication. Okay, so let's say this is my story. I don't remember the medication right now, but I'll tell you, I'll remember it in a minute after I tell you the story. Okay, so it's Tam. So Tammy has breast cancer. Tammy is Jamaican. She likes oxtail, so Tam Ox. And she's finna go to a party, so tamoxifen. So tamoxifen is a breast cancer medication. And so when you learn the medication, you learn the classification, and you learn the side effects and the contraindications and all of that, you make everything into a story. I'm telling you, it's going to cut down on your study time. You're going to retain the information longer. Even if you don't know the medication right off the bat, if you tell yourself the story just like I did, I bet you'll know what that medication is. Tamoxifen. I didn't know it before. I know that it's a breast cancer medication, but if I don't tell myself that story, I'm not going to remember. And especially if you have to learn like 30 medications and 40 and 50 medications, you know, within that chapter, and then not even touching the next chapter that you have to learn that has its medications, that's a lot of medications to learn. And not the name, the trade name, but the generic name and the classification. Some medications have 9 classifications, and you have to know all 9, and it becomes very overwhelming. So what I do is also, especially when studying, like if I'm studying a PowerPoint slide, like today I'm studying 2 chapters, so one PowerPoint slide has about 53 slides. I'm not going to sit there and study all 53 slides in one sitting. What I'm going to do is study like 10 of them. I'll study 10 of them, and then I'll go back and layer on some more information from the other chapters so that I won't forget. And then later on in the day, I'll come back, study those 10, and I'll add a couple of more on. And then at work, I'll study more, and I'll just layer on the information, because it gets overwhelming, and then you start getting all crazy when you say, oh my God, I got like this 53 slides in this, you know, PowerPoint, and how am I going to learn all of that? It is possible, and you can learn it, and you can master it, but you have to break up your information. Don't sit there and study a whole bunch of information in one sitting, because you're not going to remember. And if your mind isn't focused and there's a lot of distractions around you, you're not going to absorb and retain that information. So if I know I'm tired and I'm sleepy, I'm not doing anything. The most I will do is practice some NCLEX questions, but to actually study material when I'm tired, that's not working out for me. I'm not even going to waste my time, because I'm not going to know what I read, what I studied within 5 minutes. It's just not working. So you have to know your study habits, know what you can do, what you can't do, know how you absorb the information, know how and when you are able to retain and absorb that information, because you're just wasting your time if you try to study when you're sleepy or something like that. You could be doing something else, like practicing questions. There's really no absorbing of information. You're answering questions, so you can knock some of that out the way. If you have the ATI, look at some of the videos and knock some of that out, because some of those videos are like an hour and a half in order for you to get that 100%, of viewing, or that for that module, you have to go through each and every one of those little module points in order for you to get that full 100. Because for me, like, a lot of it, I'm like on 75 and 55 because I didn't go through everything. And a lot of us are doing that. I don't want to, okay, I'm not going to say anything. But if you're on ATI, there are ways for you to access information concerning the test. So if you are accessing that information, okay, so that you can just get through the test, fine. But don't shortchange yourself, and after you submit that to your teacher, you need to go back in and actually take the test for you and say, how am I doing on this material? Do I really know this material? And go back, and you need to go back and study and practice those questions, because accessing that information in a particular way just so that you can say that you did it and get your credit is totally different than when you have to understand the material. Because if you don't understand the material and you just did what you needed to do just to send that information in to get your credit, and you didn't ever go back to actually read the question, understand why this question is right, understand why that question is wrong, the answer is wrong, then you're shortchanging yourself. So that's all I'm going to say about that. If you know what I'm talking about, you know what I'm talking about. If you don't, I don't want to mess it up for everybody else. Okay? Because people watch these videos. So you guys, I think that's it. It's getting dark. So I don't want the light in this video to go out. I don't know what else to tell you. I will let you know how I'm doing on my other test when I take it March 6th. And I will try to think of some more tips and tricks and advice to give you guys. But until then, if you have something that you want to know about, you can leave it in the comments area, and I will get back to you. Okay, talk to you guys. Bye.